Um, Good morning or good afternoon, depending on where you are, and welcome today to a webinar about the impact of COVID-19 on global vector control and research efforts, organized by the Global Health Network based at the University of Oxford and in partnership with the Global Vector Hub and ArcTech at the London School of Hygiene and Tropical Medicine. Thank you all for attending today and welcome to those joining via Zoom and on Facebook. My name is Frederick Zielik, and I'm the Partnerships Manager at the Global Vector Hub at LSHTM. I'm delighted to be joined today by Professor James Logan. He's the Head of Department of Disease Control at the LSHTM and also the Founder and Director of ArcTech. Moreover, I'll be joined by our panelists, Dr. Grayson Brown, the Executive Director of the Puerto Rico Vector Control Unit, Dr. Damaris Matoki-Muhia, the Deputy Director of the Kenya Medical Research Institute and Program Manager at the Pan-African Mosquito Control Association based in Kenya. And last but not least, Dr. Raman Velayudan, who is the Unit Head of the Veterinary Public Health Vector Control and Environment Unit at the Department of Control of Neglected Tropical Diseases at the World Health Organization in Switzerland. Thank you again for joining us as panelists. So we are here today to share experiences around how we are responding in the global vector community to the COVID-19 pandemic. And in particular, we will discuss with our panelists the current vector control situation, for instance, which vector-borne diseases are being neglected due to COVID-19, what major gaps are there in our knowledge and in data availability, how can these gaps and shortcomings be mitigated, and what are urgent funding and communication needs. Moreover, we'll be discussing future preparedness. How might vector control operations and vector research need to change to adapt? And how can we improve epidemic preparedness and prevent future outbreaks? During this session, we will hear from each speaker, and towards the end, we'll have plenty of time for the Q&A. Please note again that this session will be recorded, and a recording will be made available online very soon. To interact with the panel and ask your questions, just a few housekeeping issues. To ask your questions, please use the Q&A box in the toolbar at the bottom of your screen. For those on Facebook, please also share a question in the comments. It would be great if you can introduce yourself and your name, role, and location, and we'll try our best to get through all of the questions in our time allocated. You can also interact with us on Twitter today and find out about future events at info-tghn and our own Twitter feed at Global Vector Hub. As I said, this webinar is being recorded and will be shared via the Global Health Network for reference and for those unable to join us live. So we're going to start now, and our first speaker today is Professor James Logan, who will introduce the Global Vector Hub. James, over to you.
Thanks very much, Freddie, and hi everyone. So I'm the head of the Department of Disease Control here at the London School, and I head up the new online resource called the Global Vector Hub, which many of you will have seen was launched recently, and I'll tell you about that in a few more minutes. First, I'd just like to thank the Global Health Network for helping us to organise this workshop, to Freddie for chairing, and of course our wonderful panellists, and to all of you for attending as well. It is very much appreciated. For those of you who don't know about the Global Vector Hub, it's a community-led online platform to allow access to an exchange of information and data on vector control and vector biology. And this includes access to vector data, a repository for data as well, which can be viewed using interactive maps and can be downloaded. It's a worldwide network of vector researchers and people working in vector control and organizations. And it's also a resource which includes extensive databases of training and educational materials, vector control guidelines, and research tools. And ultimately, it aims to assist in capacity building and establishing a community of practice, connecting stakeholders, and ultimately playing a role in reducing vector-borne diseases. So please do visit the website, which hopefully you can see now. What you will see when you get there, it's not a finished product, but because of COVID-19, we felt now more than ever that it was important to support the vector control community. So we decided to launch an early version of the website without some of the functionality that it will have later on. So please do keep coming back. And we do hope that this is going to be your sort of go-to place for information, data, and networking as well. So what you'll also see on the website is there was a survey, or there is a survey, and please do take that survey. We're interested to understand the effects of COVID-19 on vector control and research. Now, the survey's actually been up for a few weeks already, and to help set the scene of the workshop, I thought it would be nice to run through some of the results that we have so far. I can just get this slide to move on. So we've had 160 individuals from 45 countries take the survey. We had a high proportion of people in the USA, which I think is a reflection of the networks who helped us to distribute the survey. And if we take out the USA, not that it's not important, but we can see some of the other countries here in a bit more detail. So you can see we've got a really nice representation across the globe. And what you can also see is the type of people who took part in the survey. Most people work in vector control, as you might expect, but we had great engagement from other related but distinct disciplines, as well as the commercial sector as well. Looking at the job role of the participants, again, there was a good spread of job roles, including people working for governments and aid workers, as well as people in the sort of vector control operations. And academics. Now, some of the interesting statistics that we've pulled out so far from the survey are as follows. So 25% of respondents are now working on COVID-19, which perhaps suggests that there has been a diversion of manpower and resources to tackling the pandemic and possibly away from vector-borne disease control or research. 64% believe there would be long-term changes to vector-borne disease control policy and practice. Only 33% felt that government guidance on vector-borne diseases during COVID-19 were actually useful, which suggests that more could certainly be done in terms of preparing and guiding through public health emergencies such as the COVID-19 pandemic. 57% felt that research and control operations were greatly or extremely affected by the pandemic. So these statistics basically tell us that there are severe disruptions, it appears, due to COVID, and there appears to be a lack of guidance within the vector-borne disease control sector as well. Now, if we tease this apart just a little bit further, you can see that some of the main issues are relating to things like availability of staff, travel due to lockdown, access to resources, and finances. And of course, all of these things will be creating a very challenging time for vector control and research in various countries. And these are the diseases that are listed as having been most impacted by the pandemic, with malaria right at the top, but the arboviruses very close behind, as we might expect. Finally, there were some comments that were left by respondents on the survey, and we've highlighted some of them here. So, for example, there was a feeling of a gap on guidance that is specific for COVID mitigation during vector surveillance. Another gap that was found was on understanding the interaction between COVID-19 and the different individual vector-borne diseases. There appeared to be a feeling of confusion and a lack of quality leadership, which seemed to be causing problems and possibly harming trust with the public. And there was also a feeling of not being listened to by governments and other agencies, and people struggling to get messages out to the general public about vector-borne diseases due to an over-domination of COVID-19 messaging. So as I say, we've pulled out some very sort of interesting statistics from the survey, and we'll be disseminating this in a more formal report soon to all stakeholders, and hopefully you'll all get a copy as well. But hopefully this has just given you a bit of an insight into the sort of general feeling in the sector, and perhaps you can already relate to some of this. And hopefully this sets the scene a little bit for the discussions today. So thank you very much. I will now pass you back to Freddie, and I hope you all enjoy the workshop. Thank you.
Great, James. Thank you very much. This is really helpful, very insightful. So I was thinking maybe if we could by now set the scene, and I would like to start with asking Damaris and Grayson perhaps for first impressions, let's say from the ground. What is the situation in your countries? So if you could perhaps introduce yourself and your organization briefly, and then describe what you're currently experiencing in terms of your vector control operations, but also how this is being impacted by COVID-19. So Grayson, should we start with you perhaps?
Sure. So I'm the executive director of the Puerto Rico Vector Control Unit. We are an independent unit. We're funded by the CDC. In Puerto Rico, vector management is basically in two components. The individual municipalities have responsibility for vector control in their city. And then we are working with those municipalities in an effort to improve their training and expertise and capability. There's also a Department of Health at the state level, and but it has only statutory and regulatory capability. Puerto Rico is a territory of the United States, not a state, but functionally it's, for many purposes, equal to a state. The Vector Control Unit has 70 people, all with at least college education, about 1/3 with advanced degrees, 7 or 8 PhDs. So it's a fairly large organization for the Caribbean. We run a network of 2,000 traps throughout the territory, which are sampled weekly. We have 2 large laboratories and a molecular lab that processes around 1,500 mosquito pools per week. So it's a fairly big operation that we run there. Our biggest problem, or our situation on the ground right now, is that we have a dengue outbreak that has begun. The official record is 253 cases so far this year, but Puerto Rico's Department of Health is notorious for under-reporting those numbers. Paper came out by Shankar in 2018. Documented that the Department of Health traditionally only reports about 5% of the cases. So we actually believe the number of cases on the island is about 4,000. Population of about 3 million on the island. We believe that this year the number of cases is underreported even more so because many of the early symptomology of COVID and dengue are quite similar, and so doctors, with all the publicity about COVID, would send a blood sample into the Department of Health. Department of Health would test it for COVID. If it's negative, then they throw it away. So many of the dengue cases were discarded in that way, for sure. And then the Department of Health simply stopped reporting dengue cases from November to May. And so the number is really seriously underrepresented this year. We have been active throughout the entire COVID lockdown situation. Our field teams have been out processing samples. Our laboratory teams have been operational. Our community outreach team has been working effectively. But we have had to change the way we do a lot of things, for sure. Our laboratory teams have to work in staggered shifts, and it really impacts our molecular lab, where we don't really have that many people to stagger shifts for that. So we were limited by the number of samples that we can process. Our community outreach team, which is maybe 1/3 of our whole team, is of course seriously impacted. Can't have the town hall meetings, the leadership meetings that they normally have, the health fairs, and all of the public events that they typically run. So those have all been affected. We've had to try to switch people over to virtual meetings as much as possible, which at the community level works eventually. I mean, we're getting to the point where we can do that, but initially that was a real problem for us. But we're pretty much operational. Our main problem, though, is that the State Department of Health has decreed that no pesticides can be applied for vector control throughout the territory, not even granular larvicides. So we can't do any adulticiding, we can't do any larviciding. Not just us, but nobody. The municipalities cannot The professional pest control companies that work around the hotels cannot, nobody. So we are trying to convince the Department of Health to change their mind. And in fact, the National Dengue Branch is headquartered there in San Juan, Puerto Rico, and the chief of the Dengue Branch is meeting with the Secretary of Health this morning to try to convince him otherwise. And we'll be showing him a couple of papers that just came out last week. Freddie, are you going to talk about those papers later, or do you want to mention those now, or you what?
I mean, feel free to mention them now already.
Okay. The U.S. Center of Disease Control and Environmental Protection Agency just came out last week with a joint statement on the need to maintain vector control in light of the COVID outbreak. That's in the weekly mortality and morbidity reports, July 17th. And then there was another paper, it's actually still in preprint form, from a number of great authors in journal Trop Med on dengue and the COVID outbreak. And so I encourage you all to look for those papers. They're available online. Anyway, we're using that information to try to back up our position that that we should resume vector control on the island. If we don't, we're going to have a fairly large outbreak. I should point out that dengue 1 is the only strain that we're finding in our mosquito populations. That's been pretty much the pattern here in the Caribbean for the last year or two, is to start off with dengue 1 and then follow it up with either 2 or 3. And we are now getting reports of some human cases of dengue 2, although we haven't found it in the mosquitoes yet. So the last dengue 1 outbreak here was 2011, so we're not expecting this to be a major outbreak, but 2 was 2003, so that would be a much more significant outbreak if it gets going. So we're really concerned about that. Typically, a dengue outbreak in Puerto Rico runs for 2 years, and we are in the beginning of that 2-year cycle. So that's where we are.
Okay, great. Thank you very much for this really in-depth summary of your situation. This is quite insightful. And I think then we can move now to Damaris in Kenya. And I assume there the situation might be somewhat different. So Damaris, if you could please introduce yourself briefly and then tell us about the situation there, please.
Thanks, Freddie. Damaris Matoke from the Kenya Medical Research Institute as a where I work as a deputy director, and also a program manager as the Pan-African Mosquito Control Association, which covers the continent as far as vector control activities is concerned. Speaking of vector-borne diseases, our situation might not be as different from Grayson's, but I could say that it's somehow worse. Pointing out that considering the current pandemic, which has caused the move from the focusing on vector-borne diseases by either redirection of the financing, by human resource capacity, and also the idea of other activities that we have been doing continuously previously are not being implemented. To point a few, like for control of malaria, one of the things that we've been doing is continuous surveillance of the disease. This is both infection in human and also the vectors. This has been has been paused for now because of issues to do with lockdowns. We cannot access communities because then there's that fear of COVID transmission going on. Therefore, routine surveillance has been affected. The other thing is cases whereby people go for a health-seeking behavior has changed, because even though you feel like the symptoms that you're having is malaria, people are not accessing health facilities, because one of them being the stigma associated with COVID, because you'll get to the facility, one of the things you might be done for is screening for COVID. So this is something people are uncomfortable with. And also people are not allowed to move from county to county in a way that moving from one area where they are to access health facilities in another area. So that has affected in a way that we get data on who is being affected by vector-borne diseases, be it malaria, be it leishmaniasis, be it filariasis, be it arboviruses, pointing at just a few, dengue, chikungunya, etc. When COVID started, especially in Kenya, there were issues to do with a lot of rainfall, change of climate. So there was increase in temperature and there was rainfall, and we had assumed, or we knew that issues to do with dengue or chikungunya, arboviruses could be on the rise. But we couldn't travel to sites that are always hotspots of this disease because of the current lockdown. So there's that impact on diseases such as dengue, because we can't track the cases. More so, we are not able to identify whether the vectors are on the increase. We are not able to know the densities and abundance and occurrences. So these are things that have been affected courtesy of the current pandemic. The other thing is NTDs, that's the neglected tropical diseases. To point a few is leishmaniasis. Leishmaniasis occurs in areas that are remote settings, where we have accessibilities and issues to start with, even from before. But with COVID now, even going to those places to be able to screen people, also to even identify where cases are. Recently, like in Kenya, we had an upsurge, an emergency of leishmaniasis in an area that initially way back there was leishmaniasis, but the cases started being reported and there were a few mortalities. Even responding to such an outbreak was a big issue. The government could not be able to direct finances to leishmaniasis because yes, it's considered that the mortality is not as high as what COVID is doing, but we could say that that's not the case, because then we are not screening the people based on that outbreak. We are not doing vector control activities, meaning transmission is ongoing. So the effect has been bigger, and we think once the COVID lockdown all cars, we are able to come up with strategies in surviving through the pandemic, because we are very sure that this COVID is not going to be out of the country or to be out of countries soon. So there's need for us to be able to come up with strategies on our way of working through the pandemic as far as control of vector-borne diseases is concerned. So for Kenya, and also speaking on behalf of PAMCA, various vector-borne response to vector-borne diseases have been affected, and this does not only talk about malaria alone, but many other vector-borne diseases. So also to say that resource allocations, which has been diverted in response to COVID, so we are resource constrained, and therefore we need to think how can we get more resources as far as responding to vector-borne diseases is concerned. So I think that's what I could say for now.
Brilliant. Thank you very much. This is really, again, really helpful to get this perspective from your region and your area, and yeah, the different challenges. But also, I like the fact that you also highlight the need for sort of long-term strategy and basically getting an exit strategy that integrates vector control and vector management. So perhaps moving on then to the international level, Rahman, if you could perhaps give us some views from the WHO perspective. What is sort of the policy and what are the challenges that you've been experiencing?
Thank you very much, Ferdy. Just to begin with and introduce myself, I'm the unit head of Veterinary Public Health, Vector Control and Environment in the Department of Neglected Tropical Diseases and in WHO. And basically how we operate is we have three levels of the organization. We have our regional office, and we have around 140 country offices. So we basically work right across all the three levels. Now, to answer the question, basically dengue and Aedes-borne diseases affect about 129 countries globally. And unfortunately, in 2019, we had an unprecedented outbreak of dengue in many countries, which have been attributed to several factors. There were high density of mosquito population, susceptible dengue serotypes circulating, favorable temperatures, etc. But the situation is in 2020 also, this outbreak has continued. And today, over 2 million cases of dengue have been reported in over 25 countries. Many of the affected countries are in Latin America, the South American bloc, mainly from Brazil, Bolivia, Paraguay, and so on. And the other noted countries are from the Southeast Asia and the Western Pacific region of WHO, which includes places like Indonesia, Sri Lanka, Singapore, Nepal, and even in parts of Africa, Yemen is also badly affected by dengue. So essentially, the situation is pretty grim, and we are faced with many challenges. The COVID pandemic is undoubtedly placing immense pressure on the healthcare and management systems worldwide. And what we have done at WHO is to emphasize the importance of sustaining efforts to prevent, detect, and treat vector-borne diseases wherever possible. A similar approach, we are trying to advocate for dengue and arboviruses at this crucial period, because a combined impact of COVID and dengue could have devastating consequences on the population at risk. We are in touch with all our country offices, and we have actually made use of this opportunity to have a lot of webinars with our country office colleagues, including program managers of the national programs are drawn into discussion. So almost every day we have discussions with them. And what we get, say, let's talk about the negative side of things, what the present situation is all about. In many countries, vector control routine operations has been postponed. Surveillance has completely stopped, mainly for arboviral diseases. Our medical technology people who does the diagnosis have been diverted to COVID work. And many breeding sites have been abandoned, especially in urban areas. Construction has been stopped, so most of these sites are abandoned, providing ideal ground for Aedes breeding. And there is also a lack of media interest. Now, I would also like to add the positive side of things. The positive side of things is we are using more of community health workers in many of these countries, because they have been provided with PPE, they have been provided with social distancing measures, and they do visit communities on a regular way. So basically, community health workers can play a significant role, and we really hope they can contribute more in the coming months. The second positive thing is we are involved in a lot of online training. This is an opportunity to train people at the periphery, reorient the program wherever needed, make sure that appropriate surveillance can be started. And so this is something which we are encouraging countries to do, and we hope a lot of work can be done in that direction. The third interesting thing is we are also encouraging countries to do entomological surveillance even in quarantine centers, in and around quarantine centers, because we really do not know how many of these migrant workers who are returning back to their country are coming back with infection. It could be malaria, it could be dengue, it could be chikungunya, but they could provide another potential for mosquitoes to get infected in the neighborhood. So entomological survey in and around quarantine centers is being done in some countries. And the lockdown situation also provides an opportunity, because we are encouraging communities to, basically families, to work together once a week, clean their surroundings, make sure that breeding grounds are reduced in and around their homes, and throw most of these solid waste as part of their garbage, because garbage collection has already picked up in many countries, and many countries are putting a lot of emphasis on it. So we are trying to make sure that a greater emphasis is placed on prevention. We are trying to address the issues of the challenges we really face with diagnosis, with case management, and so many issues which we constantly face. So basically, even in diagnostics, we are trying to make sure that the primary care health facilities can do the diagnosis and manage some of these cases. Of course, from the dengue side, as well as from most of these vector-borne diseases, there is a huge challenge of referring patients for treatment because most of the beds are occupied by COVID. So we want to avoid all this. So we are making use of this opportunity to build capacity, support programs wherever we can through our local offices. And as I said, using community health workers and other partners who could be involved in prevention and control of dengue and other vector-borne diseases. Over to you. Thank you.
Thank you very much. This is a really succinct summary of basically the global perspective. And I must say it's difficult sometimes not to get too disheartened by the combination of all these overlapping crises of COVID-19 and of arboviruses and other vector-borne diseases and humanitarian crisis. You mentioned Yemen, for instance. So it's really good to hear some positive and some optimistic notes as well. And I think this is exactly what we also need, that we can have some constructive outlook to the future and also come up with approaches and solutions how we can address these things. So I quite like what you mentioned at the end about the community engagement and how to overcome this. So I was wondering, friends, going back to Grayson perhaps, do you have, you mentioned earlier that you've moved now to online meetings in terms of the community engagement. Do you see this also as a way forward for the future, or do you have any other, I don't know, plans, and how, basically what will be next in the future once we're out of the COVID-19 crisis in terms of vector control? Oh, sorry, you're on mute.
Great question. I've already had a couple of questions related to some of our community outreach efforts, and that really is our main focus right now. Other than the the traps and mosquito testing, that's fine, but it's our team is spending most of their time actually in the field as the lockdown has lightened up a little bit. And what we've been doing is handing out larvicide samples to people, teaching them how to do that. And we perform what's called a CAP survey, knowledge, attitudes, and practice survey that is based on container indices, is showing pretty good success. It's very labor intensive to go house to house, but we have the labor to do that. We mostly work in these municipalities with what we call community leaders. These are local neighborhood association presidents and that type of thing. And they're the ones with whom we mostly work with in virtual meetings, besides the town halls and that type of thing. But those community leaders are the ways that we get into to the barrios, the urbanizaciones, and that type of thing. That network of community leaders will persist after the COVID thing is resolved, and I'm sure that that's going to be our way forward. I'd like to point out also that our community program, very large, we're actually marketing that to the COVID managers right now. We are submitting proposals for funding where the objective is to manage the COVID project, COVID outbreak through community outreach, but using our community team because we've got the infrastructure and the network throughout the territory. We also have outbreaks of influenza and mycoplasma going on. And so I really feel like if we build up our community team and continue to strengthen them and learn better about how to use them, that this will be a group that we can apply to other infectious disease outbreaks in the area.
Excellent, thank you very much. And I think that also chimes with what Raman was saying, that sort of repurposing or employing well-equipped and protected health staff and to tackle other diseases. However, I think that one of the major challenge there is to have sufficient funding. And perhaps Damaris, perhaps you could also give us your views on that. because you mentioned also a lot of diversion of existing resources now to tackle Corona. Is that something you see as the major challenge in the way forward from the Kenyan perspective?
Thanks, Freddie. Yeah, I think the diversion of resources, yes, is one of the challenges, but I can also say the human resource, because now everyone who was working on vector control activities went into addressing the COVID pandemic. So I think that contributes to the challenge in responding to vector control activities. But the other thing is the community now accepting that still vector-borne diseases do exist, because then the assumption, because every focus is on COVID, the assumption is that any symptoms someone has, they assume it could be COVID and they don't want to be told it's COVID. So that kind of stigma in responding to other diseases because you'll be labeled like a COVID positive individual. So I think as far as resources is concerned, we need to just look keenly and make sure that the gains that we've made, because one of the cases that I like to point out is that we know that the use of insecticide-treated nets has been used to avert infections of malaria about 69%. And we have the use of insecticide, indoor residual spraying of houses that has averted infections of malaria up to around 10%. That's around 79% in the use of vector control tools. So if it does not continue or get strengthened, then those gains will be lost because of responding to COVID. So that needs to be strengthened, re-emphasized, so that we continue to, if not just sustain, increase the coverage and also make sure that we don't lose the momentum. The other thing I wanted to say, especially for the Kenyan experience, is decentralization of most of these routine surveillance or vector response activities. Instead of them being done at national level by the national level teams only, we empower units at county levels. Kenya is divided into various counties, therefore empowering people at the community level to be able to address vector-borne diseases would be of advantage. Yes, I know we've been engaging communities, but now getting to a point of making sure that they can actually respond to where are these breeding sites. How can we use the larvicides, if it's larviciding activities, without really waiting for the national team or any other administration to come and help them address this. Then also engaging, because in Kenya we engage community health workers in maybe identify where the cases are, but now empowering them and providing them with the resources required in reaching out to the cases, or in going out to make sure that households have the required vector control tools, be it the use of bed nets, and also making sure that the nets are in good condition. So empowering communities will be a very good support system that we can utilize. The other thing is that now also we've gone into virtual meetings as a country, and also speaking from the PAMCA perspective, whereby we are engaging various countries and trying to understand how they are responding to vector-borne diseases. This Kenya is just an example, but this is a replica in other countries in Africa. So also going into online platforms by speaking through engaging counties through virtual meetings, and also making sure that the supplies, be it commodities such as drugs, be it those nets, the vector control tools, that we make sure that they are there and they don't run short of those. So I think those are the areas I'd like to mention.
Great, thank you very much. And I really feel like this is this common theme of the need for supporting local community health workers, community health staff, because they are really the ones on the ground. And I could imagine this is quite intensive in terms of training, in terms of resources, in terms of funding. So I think this is definitely something we will need to convey to the global funding community. And perhaps just as a last question then, to Rama and to wrap this up before we move to the Q&A session. Is that something that I assume it aligns with the policies of WHO and also what you've described earlier. So are there any other future plans for WHO to basically for an exit strategy and for future vector management?
Well, basically the situation is the same for us. We also lack funding and resources, and what we are trying to do is, as I said earlier, to strengthen capacity at the grassroots level and to make sure they are equipped. So with the limited resources, we want to make sure they have the surveillance tools if needed, a few traps if needed, to just make sure we can carry out some level of sentinel surveillance. Even with the community health workers attached to health units, we can basically target hotspots and ensure that there is some level of surveillance. The other important point we are trying to emphasize is integration of the surveillance system. In other words, we want to make sure that the clinical side of diagnostics works hand in hand with the entomological side, because when these two combine, we really are able to track down the cases of dengue, for example. If there is an outbreak in a particular spot, we would be in a position to track it down earlier, make sure the vector densities are managed, and we are trying to focus on that sort of intervention. So basically, the situation is the same. And from WHO's perspective, as you may know, we have the Global Vector Control Response Strategy adopted by the World Health Assembly in 2017, which frankly emphasizes on these pillars: vector surveillance, community involvement, scaling up vector control tools, and making sure capacity is built, and so on. So we have a platform already. We are encouraging countries to integrate the key elements of the global vector control response so that every country can adapt to it. And frankly speaking, many countries have come forward. They are carrying out a few needs assessment and adapting the vector control in a more integrated way. So basically, we are talking of a vector surveillance covering all diseases. And we need to remember at the back of our minds that vectors are migrating, and we have not tracked them very well. So we have outbreaks of West Nile in parts of India, for example. We have outbreak of another disease in another part of the country. Now, how does this happen? This is because the vectors are moving. We also know the story of Anopheles stephensi moving into parts of Africa. So all these are new challenges for us, and we really need to keep a tab on them. And of course, as many others have already said, we have to adapt to the new norms. And this is the big challenge, and we don't have an answer to it, but I think our global strategies provides the ideal pillars for it. We welcome countries to adapt their strategies accordingly, and we learn from countries, to be honest. We really want good case studies on how countries are doing work under this tiring circumstances, how we can tap community workers, how we can tap other private sectors if possible to get involved, because as I said earlier, most of the government staff are being concentrated on COVID response, and rightly so. So we really need extra hands, and these extra hands have to come from outside the health sector. And we are quite happy that community health workers are playing some role in few countries. Few private sectors are coming forward to help, and we really need more such examples. Thank you. I'll stop here.
Excellent. Thank you very much. And I think that was already a very insightful and an exciting panel session so far. And I've taken quite a few interesting messages away already. Perhaps as a general reminder on everyone who's listening to have another look at the GVCR document issued by the WHO in 2017, because it is really, really helpful and has a lot of useful content that is now more relevant than ever. So now I'd like to move on to the Q&A session in the remaining time. So my colleagues have collated some of the questions that have been posted in the Q&A section. So perhaps one emerging theme is the centers around the evidence of comorbidity of COVID with dengue or other vector-borne diseases. So for instance, but how can we tackle more than one disease at a time? and also, as what has been mentioned before, how do we get through, also what Damaris had mentioned already, how do we get through that other vector-borne diseases are still an issue? So how can we cut through the suction that the COVID-19 is creating in the public attention? So perhaps, Raman, could I start with you, and if you have any thoughts on this?
Thank you. Yeah, basically the questions on comorbidities, it's a bit difficult to answer because we don't have any published evidence on it right at the moment. But what has emerged is many countries have highlighted through their website and publications, especially for dengue, that it is a threat, and it is a looming threat which will get worse soon after the rains, which especially in parts of Asia, it will be starting right now. It's a monsoon season, and as dengue outbreaks scale up, we really have a challenge. And here, this is where we want to focus more on primary healthcare level, where we can diagnose severe dengue, for example, and make sure that these cases are referred to the tertiary health facility. And we are encouraging units, especially at the state level, to have certain beds at least earmarked for severe dengue in case the cases are going to increase. But at the same time, at the primary healthcare level, we want to make sure that prevention measures are put in place and the key messages are sent to the patient and the community at large. So the threat is looming, and we are trying to see how we can mitigate this through other means, and in spite of the health system being severely overburdened. Between dengue and COVID, both are viral diseases. And there was a publication that it can confuse things a bit in the diagnostic side. But I think here we want to emphasize on quality diagnostics. So a rapid test should be of very good sensitivity and specificity for dengue to get a good answer. And the case should be sent for confirmatory test in case the dengue is suspected in a particular locality. But I think these two viruses do have common symptoms too, and we really need to be on watch for both. Over to you.
Thank you very much. Yeah, perhaps Damaris, you had also mentioned previously the challenge that you're experiencing with the co-infections or also the perception. So perhaps you could elaborate on this, and if you have any suggestions how to overcome this in the future, this focus on COVID-19.
Yeah, thanks. One of the things that we are currently doing is when screening for COVID, there are teams that are also screening for other comorbidities, especially the arboviruses and dengue. So if we can continue doing the screening, it's possible to pick the cases and be able to identify when we are getting an emergency of a disease such as dengue or chikungunya or any other arboviruses. And also we have patients being screened for malaria, because Kenya is a malaria endemic country. So that one will help be able to pick the cases early enough before it gets worse. That's if patients go to the health facility for treatment, because we are not going to the communities to look for them. But the other thing is sensitizing communities to be able to go and seek treatment once they develop symptoms related to vector-borne diseases, such as malaria and dengue. So still making that, keeping on passing on that messages such as go for health, go for treatment, get checked. If it's malaria, get treated, other than people going for over-the-counter, because we have a lot of self-diagnosis whereby someone feels that they're feeling like malaria and they treat, and then they end up getting worse. So also the other thing that we've learned, especially for COVID, is prevention, because right now their emphasis is social distancing, washing hands, and others. So from this experience, it shows that we need to put more into preventative measures and strengthen the prevention more, other than get a case and treat. because this will help us in controlling of vector-borne diseases going to the future. The other thing that we are putting in place as us is still continue with our routine surveillance, but now not in the normal way, because there is need of investing on PPEs, because now you can't go the way we used to go without the right PPEs, so which will take a lot of resource allocation to it. So using PPEs and also trying to dispel the myth that once you have COVID, you're unique. It's like making sure that there's that acceptance. COVID is here, yes, but also vector-borne diseases are around. Yeah, so that's what we are doing at the moment. Yeah.
Excellent, thank you very much. Because it is really, if I look through the questions here being posted, it is a recurring theme that reported from different countries, including Brazil, for instance, and also Nigeria, is that people with symptoms of arboviral disease are not looking for healthcare because they're not only fearing being stigmatized, but also they're basically afraid of becoming infected with COVID-19. So, yeah, I think that the issue of arbovirus underreporting is definitely an issue. And Grayson, you had mentioned this earlier for dengue. So is this something that do you think this is something that policy should address, or is this also something we should also be pushing for on a more general level?
Well, certainly a more general level would help. I answered one question from a viewer in Brazil that has a very similar problem that we have, and that is that a lot of the people that come down with dengue are afraid to go to the doctor. They don't want to go sit in a doctor waiting room with a bunch of people sitting around with dry coughs, and because they don't want to get co-infected. And so you have that as a major source of underreporting as well. We are starting a couple of large projects that will coincidentally involve finger sticks, so a serological survey of thousands of people in a couple of different cities. We're doing that with some other organizations, CDC and one of the health universities here. And that will give us some data, at least, on how frequently people are seropositive for both. That doesn't necessarily mean that they had co-infections, but it means that they're at least seropositive for both. And that will at least give us some idea of how bad the situation is. But right now, we don't really know. As far as the government is concerned, I think that's one of our major communication needs, is to convince policymakers that the model that we've been following up until now, not just with COVID, not just with dengue, but also previous outbreaks of Zika, West Nile virus, you name it, is whenever there's an outbreak, a large-scale outbreak, a whole bunch of money goes flowing into that one problem. And then when the problem subsides and the money is taken away, and then the whatever infrastructure was built there deteriorates. And we need to establish a way of sustainably having a mechanism that can fight infectious disease in general, and in our case, vector-borne disease. I want to get back to the community outreach program, because again, the organizations like what we have, like Damaris has, and like you see in India, is that community outreach program can be the infrastructure with which we can use to fight not just COVID, but influenza, whatever, and hopefully that way maintain an ability to reach out to the community regardless of the infectious disease that comes along. That's what I'm hoping to do in Puerto Rico anyway.
Great, thank you very much. And I think this is also focuses on some of the issues that have been really recurring, particularly building long-term capacities and thereby preventing this sort of beggar thy neighbor approach that occurs now if resources are being diverted from vector control efforts and fight a new outbreak, and instead building enough capacity. But of course, it does require commitment from the global funding community to create this, and it's there's no quick and easy solution, I believe. So I think, again, emphasizing the community health workers as the first line of defense and the first a line of intervention is really, really helpful, because I think this is really something that we should take forward.
I don't think that we necessarily need a commitment from the local governments. I think that we really probably can rely on a recurrent, some kind of an outbreak of some kind of disease occurring often enough that will keep our programs up and running. I mean, we get funded. Our Zika money was for 5 years, and this COVID money that we're trying to get will be for another 5 years. And I'm sure that over the next 5 years there'll be some other outbreak here.
Yes, yes, absolutely, and I think we won't run out of work in the future, but I think it's very crucial to get a clear message across. In the interest of time, I'm afraid we're running out of time to discuss any more questions, which is a shame, because I've seen more than 35 questions in the Q&A box. So what I propose we do is collate all these questions, and if I could perhaps email them to the panel, and then if we can attempt to answer them through the panel, and then return to the participants, that would be great. Yeah, before we wrap up, are there any other comments or any recommendations that the panel members would like to make?
I would like to make one more comment. And that is the lockdown. One of our biggest needs and one of our biggest questions is, how has the lockdown affected the spatial epidemiology of dengue? We've seen enough dengue outbreaks here in Puerto Rico that we know what the normal pattern is, and it really changed early on in the lockdown. And I'm just curious if other people in the panel have seen that as well. What we saw was hot spots were created and stuck around a lot longer than what they had in the past. We have multiple anecdotal reports of entire families coming down with dengue. We haven't seen that before. But as the lockdown eased up, then it reverted back to its normal pattern. I sure wish I would have known that was going to happen beforehand, and hopefully we can take some kind of a lesson from that for fighting a future outbreak. So I think that's one of the major data needs that I personally would like to have had filled before we got into this.
Absolutely, yeah. Damaris, please.
Yeah, I think for me to wind up is to say that we need to strengthen the use of predictive tools, that is disease modeling and others that should be able to advise. If this was strengthened, somehow we could have known issues to do with COVID. But when it comes to vector control activities, most of the time we don't use these predictive tools, such as modeling of diseases. So if we can invest and enhance that, and if it can be done country-based so that countries can take the initiatives of responding to these vector-borne diseases, it will be perfect. The other thing I would like to mention is that issues to do with stakeholder engagement, in a way that we don't work as silos, as let's say vector entomologists, so that we engage other key people or key personnel who are involved, who could be addressing maybe infectious diseases such as influenza and others, so that we work through the system other than trying to work in silos by entomologists responding to vectors and the other people like parasitologists trying to work on flus and others. So trying to work with other key stakeholders in addressing vector-borne diseases will be great. The other thing we realize that as far as COVID is concerned and vector-borne diseases are concerned, they affect a lot children and women. So how do we get to enhance participation of women in vector-controlled diseases? So my thoughts are that we need to bring that kind of rich resource persons that are always left out in designing tools that are used for vector control activities, in making decisions as far as vector control is concerned. So let's bring women on board and include them in decision-making levels. Thank you.
I couldn't agree more. yeah, I will follow up on that in my wrap up in a second. So yeah, Raman, over to you if you have any final comments or suggestions, please.
Thank you, Frederick. I think 2 or 3 points come to my mind. First of all, we need to make use of this opportunity to see how much we can strengthen surveillance, including diagnostic surveillance for arboviral diseases. In many parts of Africa, we are still trying our best to establish a routine system of surveillance for arboviruses, and we need to focus more on that to strengthen surveillance, because we need to remember all these are viral diseases, and we have a golden opportunity to strengthen surveillance across the board. The second thing which I did mention in the beginning, but which I would like to emphasize is right now there is a lack of media interest on vector-borne diseases in general. And we really need to do our very best to bring this back on. And there are regional media outlets which are promoting some of these coverages, especially dengue outbreak. There are reports that a dengue patient was not admitted and the delay led to his death. So these are things which really captivate the political people. And we really need to bring this up so that we get the political commitment, and we really need more media attention also, especially if vector-borne diseases are on the increase. And the last important thing is, as the previous speaker has just mentioned, we need to help target women, schools, and other organized network. For example, Scouts and Guides in many countries. They are a wonderful resource who are doing some very good work. And actually they are working in a few countries to help in source reduction. So we need to tap these whenever as situation slowly returns to normal. And we are, as I said, we are trying to adapt to this current situation of lockdown and making sure that under lockdown, very often families complain that they don't have an opportunity to go out and so on, but you have a great opportunity to clean in and around your house. And that works together as a team. It helps in lowering the risk of vector-borne disease. So I think we have a lot of opportunities and many challenges, and let's work together. And I think the Global Vector Hub should continue to accept questions from participants after this webinar, so that we are happy to answer them at any time. Thank you so much.
Excellent. Thank you all again. And thank you to all the participants who posted 40 questions by now. So dear panelists, thank you again for agreeing to help answering these. And we'll be in touch very soon. So yeah, it falls to me now to wrap up. It's been an absolute delight sharing this session. I've really learned a lot. And I think there's a clear need for clear communication, for strengthening surveillance, strengthening capacity on the ground, strengthening community health workers and local communities down to the family level, and particularly empower women and minority groups, and also breaking down silos. So I think we will make sure that this all gets conveyed, and that we have a clear communication. And this is a bit of a shameless advertising here. If the Global Vector Hub can be of any help with this, then we're very keen to assist. Moving on from this on now, we would like to continue and host future webinars like this, probably with a more specific regional focus, or focusing on more specific issues or diseases. So if you have any suggestions for topics, but also if you'd like to get involved in as a panelist or even as a chairing one of these sessions, please do get in touch. And because we're also very actively striving to increase the diversity, and we are always encouraging women and researchers and colleagues and vector control agents and any stakeholder who might be relevant from low and middle income countries to come forward and get in touch with us, and we'd be more than happy to connect you and help you building your capacities and your strengths. So on that note, I'd like to close. And once again, a huge thank you to the panelists and to James for the introduction. And once again, to all the over 200 participants who have joined today. And I would like to close this session now. Thank you all very much.
Thank you.
Thanks.
Thanks, and have a good day and stay safe.
Okay, you too. Thanks. Bye.